China is battling a spike in new COVID-19 infections after dropping its zero COVID policy. It comes as a new Hong Kong study warns China could see nearly 1 million deaths this winter. Our senior foreign correspondent Elizabeth Palmer reports.
Official hearses lined up along with private vehicles at the Zhangjiao crematorium in Beijing, almost 2 weeks after the Chinese government abruptly lifted its strict COVID controls, which had included routine mass testing and mandatory quarantine. At the same time, the government stopped counting cases. And as for COVID deaths, the official numbers say there were only 5 today. Social media says different. For example, this video was posted by a user in East Central Henan province, while another working at a funeral home in neighboring Hebei said deaths had increased 5-fold in a week. But there is no way to know for sure. The government has increased the number of so-called fever clinics, essentially drop-in medical centers in big cities, and they appear to be coping. They're for people who don't feel well and believe they need treatment, though many citizens just don't know how to judge after years of being told that COVID-19 is a dangerous killer. While many Chinese pharmacies are completely out of cold and flu medication, state media is pushing the optimistic view. In official videos reassuring people that this huge wave of infection will peak soon and things will be back to normal by spring. I'm Elizabeth Palmer in Tokyo.
Joining us now for more analysis is Dr. Chris Murray. He is a professor and chair of health metrics sciences at the University of Washington and director of the Institute for Health Metrics and Evaluation. Dr. Murray, welcome. Your institute is projecting more COVID deaths in China. Tell us what your modeling shows.
Well, over the next 4 months, we expect a huge wave of the Omicron variant in China. Most of them are susceptible, so there's really nothing to stop it once you take away zero COVID. And that leads to nearly 300,000 deaths by April 1st. And it could be worse. That's 300,000 deaths if they take some moderate action to slow the spread.
And if they don't take that type of action, tell us more about how your institute came to these findings.
Well, throughout the pandemic, since actually March of 2020, we have been developing models for the pandemic for every country in the world. And we run these models on a regular basis. The key drivers here are how many people are vaccinated, how many people have been recently infected, and what sort of actions the governments take to slow the spread. We do think that if they took a completely hands-off approach in China, you could see upwards of 500,000 deaths by April 1st.
And we're seeing some other modeling that comes out of Hong Kong that says up to 1 million deaths. What can the government do in light of all of this, other than returning to its really harsh zero COVID policy?
Well, the Chinese government has opted to use the vaccines produced in China that are less effective than the Moderna and Pfizer vaccines that we've been using in the United States and elsewhere. They've also not really purchased or acquired the effective antiviral for those at greatest risk, Paxlovid. And so the combination of those two could help a lot if they just changed course and took these products from outside China and deployed them to sort of slow the spread as well as reduce mortality, particularly in the elderly.
Dr. Murray, as you say this, I am grateful that we have these vaccines, that we have these treatments. But as we're seeing in the past, a surge in one place can mean a surge here, particularly that we're talking about the holidays. Does the Institute of Health Metrics and Evaluation have any projections for cases here in the U.S., especially for people who are traveling?
Well, we do. In our U.S. projections that we put out and are available on the web, on our website, we actually think that infections are peaking about now, maybe even peaked a few days ago, and will slowly go down during the winter season. So it'll stay at pretty high level of Omicron infection, but we don't expect much increase in daily deaths or maybe even a small increase in daily hospitalizations because we have a lot of immunity in the United States, both from vaccination, but also from Omicron infection, over the course of the last year.
All right. Well, Dr. Chris Murray, thank you so much for joining us, and thanks for all that you do.
My pleasure. Thank you.